Corinne is actually flying out to the NAMP conference to present her poster as we speak. So, wish her luck if you get a chance, guys. Good, Solange's here. All right, so big thank you, Dr. Lipski, for being generous enough to speak to us tonight. Everybody sent in some great questions, and what I did, guys, is there were so many different questions. I kind of categorized them into 5 or 6 categories. And so what we'll do tonight is we'll go through those and we'll try to touch on a few of those questions in each category. And if you guys have additional questions like we typically do, you can come off mute and you can ask. You could put it in the chat. I'll try to monitor that. I'll pull it up right now. And yeah, and we'll just go from there. There's some really great topics and questions from you guys. And so, Dr. Lipski, I know you from a couple years ago at my time at Maryland University of Integrative Health. But could you start off maybe with a little introduction about yourself, maybe your journey or your story about how you got into nutrition? I'm not sure I've ever heard that. And, maybe a few of the positions you've served as over the years. I think everyone's really interested in hearing about that to start.
Well, first of all, I'm really glad to be here and to meet all of you. If you put on your cameras, then I get to see you too. So I like that. David, thanks for inviting me.
Yeah.
And you can all call me Liz. That works for me just fine, or professor or doctor, whatever works for you. So let's see. My journey began in college when I started studying Ewell Gibbons, Stalking the Wild Asparagus, and I started taking field botany courses and studying herbal medicine on my own, and did several independent studies on herbal medicine and wrote a long paper, which I wish I had still. I don't know what I did with it, on comparing the pharmacopoeia of New York State to the Chinese Yellow Emperor's herbal medicine book, and looking at how different plants were used in the same ways and different ways. And that really started my journey. And when I graduated from college, I was teaching herbal medicine for the food co-ops in Ann Arbor, Michigan. And one night while teaching, I realized that although I love herbs, I love them so much, they're not foundational. And what is foundational is food and sleep and a sense of meaning and purpose and movement and community. And these are the things that really build health. And so I started looking for programs in nutrition. And unlike all of you, I had to create my own program. I did a master's degree through Donsbach University, where they sent me a box of books and a box of tests and said, read these books, take these tests, and then write a thesis. I never talked with anyone. I never saw anyone. It was really the early days. And so I started taking pre-med courses at the local community college and started to intern with an MD and a naturopath 20 hours a week in Eugene, Oregon, where I was living. And that really was such a great education. They taught me how to be a nutrition advocate and a health advocate in a clinic. And I was able to do all sorts of medical things that I never would have experienced in another setting, especially as a volunteer. They feel so badly for you that they're willing to let you do all kinds of things like give allergy shots and assist with surgeries and learn how to do EKGs and lab tests and all kinds of things. So it was a really broad education for me by my bootstraps, and also just going to conferences, which were far and few between. So I finished my master's degree in 1979. And then I got a grant to see people in the same clinic I was working at for low cost or free, which I was very excited about. And I worked there for several years. And then what did I do? Moved to Chicago. I worked as the nutritionist setting up a health spa. where people came and stayed for weeks or weekends. I did corporate wellness. I opened my own first practice. I've worked in doctor's offices. I've worked out of health clubs. I've worked in corporate wellness. I have done many, many things. And in the early 1990s, around 1993 or 1994, I was going to Genova Lab, used to be called Great Smokies Lab, and they had wonderful conferences. And I was learning about leaky gut and dysbiosis. Dr. Stephen Barry coined the term leaky gut around that time. And I was fascinated. And then one of the doctors I was referring back and forth with said to me, he showed me a stool test, and he said, these tests are going to change all of internal medicine. And I wanted to know more. So I talked to the people at Great Smokies Lab, now Genova, and said, I think I'd like to write a book on leaky gut and dysbiosis. And that was the impetus for me to write the first version of Digestive Wellness, which is now in its fifth edition. I think the first one came out in 1994 or 1995. And then I wrote a book on leaky gut syndrome in 1998, and both of them were the first of their kind. So I've really been a pioneer. In 1991, I heard about an exam, and that exam was to become a certified, to become a CCN, a certified clinical nutritionist. And I talked to the executive director at the time, and she said, oh, well, you don't have the right credentials. But if you can come to San Diego in 2 weeks and sit for the exam and pass it, you could be grandfathered in, because the first year we have to grandfather in anybody who's been working in the field for a long time. So I did that, and I got my first credential, which I was pretty thrilled about. And then in 2001, I went back, in 1998, I went back to school and got my PhD in clinical nutrition and functional medicine at the Union Institute. And it was a great program for me because I developed my own program. We didn't have what you have. I didn't have it. I helped pioneer the field, but I wasn't able to, I just had to do it my own way, which works for my personality anyway. I'm kind of a early adopter, self-learner, so that all worked for me. And I've been on, so I was on the first board of IAACN for the CCNs. I was on a board for an early board at NANP, National Association for Nutrition Professionals. I'm certified by them. And then I also helped develop the GI module for the Institute for Functional Medicine, and I've been teaching that since, I think, 2009. And I also teach for the MMI fellowship program through A4M in integrative medicine, and also on their GI faculty. And with the American Nutrition Association, I was really there at the impetus of kind of, in fact, we met at Maryland University of Integrative Health for our first big meeting of the American College of Nutrition and the BCNS, which certifies us, and who else was there? Some of the other schools, representing the schools. And there we birthed kind of this merging everything together. And I worked on the creation of the ANA in the form that it's in now. I also helped create ACNPE, which accredits nutrition programs and supervision programs for CNSs. And I've been really lucky to just be in the room. I think I just got there early. And what I'm going to tell you is, did I plan any of this? No. I think life just unfolds, and we are like leaves flowing down a river. And that river takes us all kinds of really interesting places. And so just being open to what's around us and what's offered to us. And hopefully somebody will see your brilliance and they'll go, I really see something in this person. And they'll take you under wing and they'll mentor you and they'll hold your hand. And you also will find yourself shaping this field, because we are really a young profession and we need leadership. And I'm hoping some of you will take up that leadership, because I'm ready to kind of put some of it down personally. I've been doing it for a long time. So I'm kind of like, I've been, this year I've been taking a break and just doing a few things and keeping lists of books I want to write and papers I want to write and podcast series I want to do and other projects. And I'm leaving everything until at least fall, when something starts yelling at me and saying, hey, it's time to do me, time to do me. So that's probably more than you want to know about me. You all send in such great questions.
Thank you, Liz. That was fantastic. Any questions for Liz, on her intro? I love that advice you gave us. Just be open, as we're young in this profession. So many of us, I remember when I graduated from MUIH, I started off with an adjunct position and then some contracting positions in a private practice. And it was just little things here or there. And it really just paves the way for bigger things later on. Yeah, Destiny, that we'll kind of end with that. I know everyone's so curious about Liz's digestive wellness course in particular. So we'll definitely touch on that. And perfect. Amanda put her website in the chat. Great. So Liz, we got a lot of questions, a lot of great questions about how to determine which area of health or healing to prioritize and, what dietary recommendations to start with. So I thought maybe we could do a brief overview of the dig-in approach, which I do touch on in my module 9, guys. I know some of you haven't gotten there yet, but Liz is the expert in this. So Liz, how about it?
Okay. Dig-in was born in an airport. And I was sitting with Dr. Patrick Hanaway, and he said, I think there's only 5 underlying issues with digestive cause. And he said them to me, and I mulled them over and kind of went back to him. Oh, thanks, David, for putting them up there. And I kind of messed around with them, and I said, how about dig in? And he goes, I like it. Great. Let's do it. So we presented this for the Institute for Functional Medicine, and then it's been in my book. And it's a very useful way of starting to think about digestive imbalances. And why we start with the first D is for digestion. And for me, that's the beginning place. As nutritionists, we think about food, right? What's somebody eating? And that's the first thing we need to really think about. But then there are people who aren't utilizing what they're eating. So even if they're eating high quality food, they might not be getting the nourishment that we'd like them to get from that food. And how we might know that is that if they go to do the pluckability test in their hair, which I learned from Jonathan Wright and Alan Gaby, if you do that and you get a lot of hair, more than a couple, then you start thinking, well, somebody's not getting enough protein, or maybe they're not absorbing protein. Or if you look at somebody's skin, and you know this already, you can sometimes see that they're fatty acid deficient. Or if you look at their nails, you can pick up, knowing how to do a nutritional physical is really important, and you can pick up some digestive issues there. People often tell you that it feels like their food sits in their stomach, or that they don't get energy after they've eaten. They feel tired after they eat. So for me, digestion, absorption, and also what goes into that is bowel motility are the first places that I think of in the dig-in model. is somebody digesting their food? Are they chewing their food? Are they sitting in a quiet space? You know, one of the reasons why we say grace is because it turns off that sympathetic drive and sets us up for the parasympathetic mode, where we're like, oh, I'm ready for this food to come in. I've been grateful. I've thanked whoever I need to thank for it. I've smelled it. I'm ready. And I'm in this parasympathetic mode so that my vagal nerve tone can like take it all in and I can actually digest the food. So that's a first place. Then once it gets into the small intestine, leaves the stomach, we start thinking about, how is that small intestine working? So the small intestine has a dual function, and that dual function is to let in food molecules and to block and keep out pesticides and herbicides and heavy metals and other things we don't want to come in, microplastics or whatever else is coming in on the food. And so we start looking at, does somebody have good barrier function, and are they able to do that? And so leaky gut is really important because we see it in so many conditions. Just being studying for the CNS boards can cause leaky gut. Stress can cause leaky gut. Bad diet can cause leaky gut. Drugs can. And so there's so many different things, but then I look at that as we move down the digestive system, you know, and indigestion absorption, we're looking at stomach acid. We might be using betaine HCl. We might be using digestive enzymes, a combination. We might be thinking about bitters to stimulate gastric acid production. If you see that somebody has parietal cell antibodies from testing that's been done at a clinic, then you know that they're not able to produce gastric acid. If somebody has pernicious anemia, which is B12 anemia, then you might suspect that they don't have enough gastric acid. You know, so looking at from those places. Also, it's interesting because intestinal permeability also plays a role in how well we can use those pancreatic enzymes. Because, for example, for all the disaccharides and for lactose, the enzymes get made on the tippy top of the microvilli and secreted from there. And cholecystokinin also gets secreted from the tops of those little microvilli. And so if they're blunted in any way, then we don't get the messages and we don't produce the enzymes to break down disaccharidases. And we also the pancreas doesn't get the message to start releasing hormone enzymes. So leaky gut, digestion, kind of they're nested together. And then we want to look at the microbiome, which we could talk about endlessly because it is another organ system. And when it's in balance, we're pretty happy and chipper. We are often of a close to ideal body weight. We have better cardiovascular function. We're less likely to have cancer or bone disease or chronic kidney disease. I mean, so many different things rely on that microbiome. And if it's out of order with fungal overgrowth, which I'm sure some of you have been seeing, or small intestinal bacterial overgrowth, or methanogen overgrowth, you're going to see that people just don't feel as well and they start getting symptomatic. And the digestive system, when it's not happy, it lets us know. So if your digestive system doesn't speak to you loudly, it's probably doing just fine. And then we think about the microbiome, and then we start looking at immune function. And immune function, again, and leaky gut and increased intestinal permeability are tied because virtually every autoimmune condition that we've studied that anybody studied has leaky gut as one of the triggers, one of the antecedents or triggers of developing an autoimmune condition. And so when we think about immune function, we can look starting from the mouth with periodontal disease, which we now know periodontal disease is associated with higher risks of Alzheimer's and cardiovascular disease and other diseases. And we can look all the way through the gut and see that there can be inflammation virtually anywhere. So we want to think about, inflammation, immune activation. Does this person have food sensitivities? Do they have food allergies? What's going on there, right? Is there a histamine response? Does somebody have mast cell issues? Is somebody having hives? Somebody having migraines? Somebody having eczema? Start thinking about the gut and immune function, because skin issues are very tied to gut. And then finally, we have the enteric nervous system, because we make all of our neurotransmitters and a lot of our hormones. We make a lot of hormones, over 30 different hormones we make in the digestive tract. So, for example, about 85 to 90% of serotonin is made in the large intestine by the microbiome. Those bugs are synthesizing dopamine and epinephrine and serotonin and all of our neurotransmitters. So when we start thinking about mental health issues, again, we want to look at brain. So let's say somebody came in to see me and they had schizophrenia. Well, I would kind of briefly look at, first, I'd be really interested in what they were eating, because in the people that I've worked with schizophrenia, they're usually not eating what I would consider at all a well-balanced diet. It's usually a junk food diet. And then as you start looking at everything, the piece that pops out to me is the enteric nervous system. So what is the role of digestion in that person? So for example, we have research that it's old research, but it was kind of brilliant, in an inpatient setting with men who had schizophrenia. And they got put on a dairy-free, gluten-free diet, and 65% of them improved. This is in your wheelhouse. We start looking. So would I start with probiotics? No, I wouldn't. Would I start looking at how we could support digestion and how we could support brain health and leaky gut? Yeah. So it depends on who walks in to see you and where you start. And these are all overlapping. And sometimes it doesn't really matter where you start. I think if we did a poll and I gave you a case, that some of us would start one place and some would start another based on where we're comfortable and what we know. And I think we can get there so many different ways.
That's great advice, Liz, because I often get questions. People are looking for definitive, step one all the time answers. So I think that's great. And your book, correct me if I'm wrong, your book has a specific questionnaire that practitioners can use with clients on which section they might want to prioritize.
Yeah. And if you want a PDF of that, you can go to my website and give me your email, and then you can download that and use it. I call it the DHAC, the Digestive Health Appraisal Questionnaire.
Yeah, that's fantastic. Definitely do that, guys, if you don't have the book, 100%. And so one of the questions we got, Liz, is right along this topic of, which area to start with when you're working with a client that's showing dysfunction in a lot of different areas. And the question was, if you had a client who has known heavy metal toxicity, intestinal permeability, and maybe Hashimoto's, how do you kind of unravel that? How do you decide where to start there?
I think it's difficult
Yeah.
to decide. But the general rule of thumb is when in doubt, start with the gut.
Yep.
And the reason for doing that is that if you don't heal the leaky gut and then you go to chelate out metals, which we're not going to do anyway, we're going to refer that out. And we could talk more about that if you have questions about it. But what I found is people can reabsorb those metals right back in if you haven't dealt with the gut, or if you haven't supported their detoxification, if you haven't supported their gut itself, then you're going to end up kind of having more metals. You're pulling them out in a place where they're actually in tissues and they're kind of still and might not be causing as much harm as when you start to pull them out. So always making sure that they have good bowel movements, that they have good detoxification before you start pulling out heavy metals. And I know that we have a lot of products and homeopathics and different substances that can help pull out heavy metals. But in my opinion, because I've worked with some of those, they're just not going to work as well as if you work with a doctor who does metal chelation work. And if you're looking for one of them, there's the Academy of Environmental Medicine, and they have listings of people in all over the country. And those doctors are doing chelation. And so instead of it taking, years and years for somebody to feel better, sometimes people start feeling better after a couple of treatments.
That's a great resource, Liz. Yeah, it was the Academy of Environmental, what was that?
Medicine.
Medicine. Perfect. I'll try to put that in.
American Academy of Environmental Medicine. Yeah.
Great. Yeah, so
Take them.
the second category that you guys had question on kind of piggybacks on some of these recent comments. So we'll kind of dive into that. Amanda's wondering, and that second category, guys, was everyone had a lot of questions about different GI conditions, right? And I think, Amanda, we might have chatted about this one at some point. You had a client that said they had this bathtub drain feeling in their stomach. Or her mom had that feeling for years. She can't figure out why. She said it feels like a drain is pulled when she eats, and it's the weirdest sensation. Have you ever come across this, Liz, in practice?
No.
Hmm.
I love it though. It's so descriptive.
Yeah, very
And
descriptive.
I'm trying to think about what. So it's almost, so when she says that, Amanda, I have a question. When she says that, does she feel like her energy drains out? Like she just feels like deflated after she eats?
Um, what she explained was it was just like a really weird, like she said that when she eats, she feels like something's pulling, like twisting out of her stomach, like a bathtub drain. And I was like, what do you mean? I've never heard that before. But she said it's kind of painful and just like draining. That's like the only term she could give me. And I was like, okay, it's okay. I was like, there's some doctors near you. I'm not sure how to treat this, but there are some doctors near you can look into.
Yeah, I mean, I would have a gastroenterologist take a look because there could be something structurally that's not quite right. I really don't know. I really don't know. But if she has pain and it doesn't feel right, then I think your advice to her was good.
Yeah, that's an interesting one, Amanda. Liz, what are your thoughts on, and this has come up a couple times with individuals where a client is maybe showing quite a few symptoms of potential yeast overgrowth, maybe even they were given a yeast questionnaire and it came back with a pretty high score, but their functional tests show negative for Candida. Um, any thoughts there? Can it hide? Can it avoid those functional tests?
So it definitely, fungal overgrowth can definitely hide on stool tests.
Mm-hmm.
If you don't see it on a stool test, it doesn't mean it's not there. And even with the newer PCR tests, they're not always going to pick it up. Usually with an organic acid test, you will see markers of fungal dysbiosis. You'll see arabinose or diarabinitol, or you'll see something. But always think about treating the person, not the test. And what do you have? And first of all, we don't treat candidiasis because that's a medical condition, but we can help balance dysbiosis. And we can help balance dysbiosis by recommending an antifungal diet. And we can also use something like oil of oregano or berberine or plant tannins or garlic. We can use other things to help bring the microbiome back into balance without treating candida. I hope you understand the distinction. When I was in my, how old was I? In my 30s, there was a woman who was working in San Francisco as a nutritionist, and she made recommendations for treating candida to some people she shouldn't have done that to, and they charged her with practicing medicine without a license.
Mm.
You know, we can do a lot within scope of practice as long as we present it in the right way. So we're always about balance. Can we treat somebody's asthma? No. Can we treat somebody's eczema? No. But can we help optimize their function, and maybe their eczema or asthma will improve?
Yeah, that's a great point, Liz. I mean, such a touchy line that we can't cross, you know, that scope of practice. I love that.
Yeah. You know, the other thing is that Dr. Crook, who developed the yeast questionnaire,
Mhm.
developed that, I don't know, about 40 years ago. And what we before we knew about small intestinal bacterial overgrowth or methanogen overgrowth or possible sulfur eating bugs causing dysbiosis and gas and bloating. And so when you look at the research, there's a big overlap between SIFO, small intestinal fungal overgrowth, and small intestinal bacterial overgrowth. There's about a 40% overlap. And so it's possible that somebody might have signs and symptoms of fungal overgrowth, and it's really small intestinal bacterial overgrowth, which is why it didn't show up necessarily on an organic acid test.
Mm, that's a good point. Yeah, you mentioned berberine there too, as a possible, you know, support therapy for the gut. And one of the questions we got in the chat right now from Kelly is, does berberine have a negative impact on the gut microbiome at all?
Mostly berberine has a really good impact on the gut microbiome. It seems to be almost like an adaptogen for the gut. It helps to balance the gut microbiome in a really beautiful way. And berberine also helps with serum lipids. It helps with blood sugar control. It's and we find it in so many different plants in the plant kingdom. It's a really important substance, and becoming friends with it is a good idea. You know, for a long time, I was really concerned that if somebody took berberine long term, that the berberine might cause dysbiosis. We're just not really seeing that. And the research on blood sugar control shows that it's equivalent to metformin and has a lot of the longevity enhancing properties that metformin has without the kind of long-term negative effects of B12 insufficiency and other things that metformin can cause.
Yeah, great question, Kelly. She had a second part here, Liz, that's interesting. Does recent antibiotic use have an impact on anti-gliadin IgA on a stool test? Specifically, could it suppress that marker, have you found?
Honestly, I don't know.
Yeah,
I
Kelly,
don't know. I wouldn't think it would, but anything's possible. And that's the other little piece of, just a little pearl is people tell you all kinds of things. Like when I eat, it feels like something pulled something out, it just went down a drain, right? And or I've had people say, I can only drink this brand of water. I can't drink any other water. And then somebody else a few months later said, well, I can only drink this brand of water. I'm like, they're not even the same water, so if people tell you something, I generally just believe it. Almost anything's possible.
Yeah, so we'll put Brenda, we'll put the chelasin resource in the chat here in just a second.
Here.
Remind me. Absolutely. Let me look through some of these. Yeah, Kelly, if you have any background or context on that question that might help, go for it as well. Let me look through a few of these.
So that question was on behalf of Corinne, who
Oh,
thought of it a little too late to email it in. But basically, she had a client who anti-gliadin came up as nothing on a stool test, like 0. And then 3 to 4 months later, she retested like 2 weeks after doing a round of antibiotics for something else, I guess, that came up on the initial stool test. And nothing else changed. Her diet improved, but on the retest, her anti-gliadin was really high. And so she was just curious, like if the antibiotic use could have suppressed it the first time. I think that was the general idea.
It could have the other piece of that is that the antibiotic use could have increased gut permeability, which maybe made her more sensitive to gliadin right then.
mm-hmm.
Okay.
Interesting. Yeah, Kelly, we'll have to tell Corinne. That's an interesting one. Yeah, I know Corinne does a lot of those stool tests with her clients. That's great. So, well, there's another question we had regarding some GI conditions from Jen Verdu. Jen, if you want to come off at any point in chat, you can. If you had a client who had pretty severe mast cell activation syndrome triggered from, SIBO, and this person can't tolerate any supplements, just a lot of sensitivities to not only supplements, but food. Where's a decent place to start with that client?
You always need to start with lifestyle. You need to start with food. What can they eat?
Yeah.
How can you slowly increase the amount of foods that they eat? I mean, first you need to do some sort of recommend an elimination diet, right? And then slowly start adding foods back in and broadening what they do. When I think about mast cell activation syndrome, I think very much of in fact, I just saw a paper today on mast cell activation and how it begins in the gut. And the cases that I've seen, they have all begun in the gut. So starting with that dig in model and doing with food and lifestyle, it's really stressful. So what are they doing for fun? What are they doing for nurture? Are they getting enough sleep? All of those pieces play a huge role. And then sometimes, depending on what else is going on, I think because mast cell, there's often some other trauma or some kind of life event that helped to trigger it. So doing some kind of counseling therapy, homeopathy, working with an energy healer. There's so many different ways of doing that: life alignment, holistic, holographic repatterning, the work of Donna Eden. There's lots of different ways of doing that. Even using things like frequency specific microcurrent. I think, like broadening and reaching out to other clinicians to see what they might have to offer. I think working with mast cell activation syndrome is really tough. And I think 80% of the time people are going to respond to the basics of what you know to do. And then 20% of the time they're not, and you might get totally stumped. And then working with somebody who specializes in it would be the next step. One of the people I know who went through the DCN program at MUIH is Jessica Pizzano, Pizano. And she's really a whiz at this because she went through it. I think first time I ever ate dinner with her, she had, I think, 7 foods. And then by the end of the DCN program, she had over 20 or 30. And, so it's always about how do we help that person heal? And supplements aren't going to be the way. And then sometimes a supplement, maybe it's just a pinch of a probiotic. Maybe it's just putting their finger in the bottle and licking that like you would do with a baby. Just the teeniest amounts of a supplement may work, but it's probably not where I would begin.
Yeah, I actually have Jessica as a professor for one of my final courses right now, Liz. She's great.
She is great.
Yeah, she's awesome. I put her name in the chat, Jen, in case as a resource. Any additional questions, Jen? I know this is one of your niche areas. Any questions for Liz?
Well, you confirmed my so I'm the client. I have MCAS and SIBO, and things just started calming down once I started addressing the kind of emotional piece and stop trying to take the supplements. Every doctor I've been through in the last 8 years is pretty much canned me because they don't know what to do with me, to be honest with you. And they're like, I've tried everything. And so I'm like, okay, I'm going to take this upon myself at this point. And I've finally seen things calm down for the first time, maybe in 8 years, about 6 weeks ago, once I started removing things from my plate, my to-do, and really focusing on healing and counseling, acupuncture, just letting go. So that's kind of been what's helping. And now I'm up to, for the first time in 8 years, I'm up to today, 19 drops total of biocidin, which I've never in my life been able to tolerate. I've been able to tolerate biocidin, but never to that extent. So yes, and I had to start with literally 1 drop every other day. So yeah, that's great. Just confirmed that I'm on the right track. Thank you.
You
fantastic.
are. Congratulations.
Fantastic, Jen.
We can't discount when people have chronic health issues. We have to always look at that emotional, spiritual, mental component, and we all push ourselves really hard.
And I think sleep was a huge factor. I wasn't sleeping. And so finally, I removed some caffeine, and now I'm sleeping 7 to 8 hours for the first time in 8 years. And now I'm like, wow, I could tolerate that food for the first time. So it's kind of a game changer. So sleep and the emotional piece, I think, is kind of what has made me feel better. So thank you.
That's great.
That's
we're all on a journey. We all live in bodies, and they do very weird things.
Yeah, that's fantastic, Jen. Excellent. Alicia is wondering, do you have any thoughts on butyrate and where it could play into part of the GI healing process, Liz?
Yeah, butyrate has been used for a really long time, even as enemas for people who have distal ulcerative colitis in the anus and the rectum. So it's long been used in that way. And butyrate is such an interesting substance because it modulates our genes. We think about it in terms of protecting the colon and providing energy and maintenance and repair for the colonocytes, but it also has drug-like effects. And it's a histone deacetylase inhibitor. It kind of stops it plays a role in DNA methylation. So it's a really important nutrient, and we find it in a lot of supplements. Usually where I like to start, though, is I like to start with cultured and fermented foods and fiber, and see if somebody will start making their own butyrate before I start supplementing with it. I don't have any problem supplementing with it, but I've seen that if we start with a food first approach, sometimes we get better long-term effects because we're helping change eating habits rather than just relying on supplements all the time.
That's great. Yeah, interesting. Yeah, interesting nutrient. Solange, I know this is an interesting one from you, I think. You had a client, you brought this to one of the live sessions once with, they had their gallbladder removed, and you had been digging around PubMed, looking for some papers to support a recommendation for what, we all hear, ox bile. And she had a really hard time finding papers, Liz, that showed, ox bile supportive of gallbladder removal. And so what are your thoughts for how to support the removal of the gallbladder in clinical practice?
We do a lot of things because they work, but there isn't money to do the research necessarily to show that they work. And ox bile has been used for a long time. I guess it's probably been used for 100 years or more. And it works because what you're replacing, and Dr. Louise Gittleman wrote a book on the gallbladder. And one of her things is it's not like we don't make bile when we have our gallbladder removed, but instead of when we eat a meal that has fat and then the gallbladder and the liver release a bolus of bile, what happens is it's just dripping out continuously all the time. And that drip, drip, drip isn't going to be enough in many cases for people to be supported. About 80%, 85% of the time, according to research that I've read, demonstrates that somebody has their gallbladder removed and they become symptom-free and they feel really great. But what if they don't? I remember working with a 12-year-old girl, and she had gallbladder issues, and they came to see me, and I said, well, they were recommended to do surgery. And I said, you're 12, and I would rather start by looking to see what food sensitivities you might have. Dr. Jonathan Wright did a lot of work and taught me that food sensitivities gallbladder issues are one of the signs of food sensitivities. And so I gave her an elimination diet, and she and her family decided they would go ahead with the surgery. And then she came back about 3 months after the surgery, and she had all the same symptoms. So we ended up kind of starting from there. And so always looking for food sensitivities. I like using ox bile. It's cheap and easy to get. I also like using lipase loaded enzymes, and various companies that specialize in making enzymes like transformation enzymes or Kirkman or Ness. They make lipase loaded enzymes. One that I've used a lot is called just lipo by Transformation Enzymes. It seems to work pretty well, and it has proteolytic enzymes and carbohydrate splitting amylase enzymes, but it's just got a ton more for fat. So those are some things that I think of. And then I also think about bitters. Bitters might help stimulate that bile dumping a little bit better too. So there's lots of things you can try, and it's always trial and error to see what's going to work for somebody.
Yeah, great stuff there, Liz. Solange, anything to follow up on that? And we'll jump to another topic here in a second.
Thank you very much. That's very helpful. Appreciate that.
You're welcome. I see there's
Great.
lots of questions about kids. There must be a lot of parents on this call. I see
Yeah,
some
let's do
children.
that.
I've
Let's
seen some children.
Yeah, let's jump to that one. I was going to do or sweeteners. I saw Renata's comment, but yeah, one of the topics, guys, a few of you sent in, questions about, what's Liz's favorite way to support kids? Obviously whole foods, right? But what about multivitamins and supplements, and, maybe the best gentle approach to address pathogenic organisms in kids? We'll start with that.
Well, the first thing is breastfeeding, if you can do it, is so important. You have to start with the beginning. And also, we have really good research on that if mom takes some bifidus infantum or other baby probiotics, that can be really helpful. I know for my first son, when he was born a long time ago, he about 10 days of age got eczema, diaper rash. He had cradle cap. He was a little fussy, and it felt to me like he had fungal overgrowth, because I probably did. And we tried all kinds of things. My pediatrician and I tried so many different things, and it just got worse and worse until he was about 4 months old, and I took him to see an anthroposophic pediatrician, and who did the work of Rudolf Steiner. If you know Waldorf schools, then you know about Rudolf Steiner, an interesting seer mystic type person. And she recommended some Natron Life Start, which is a bifidus infantis supplement. And within about 10 days, his rash and cradle cap were just about gone, and his fussiness was gone. So when my second son was born, I just started immediately, and he had none of the same issues. And we have a lot of research demonstrating that in families that have really allergic children, allergic parents, that giving probiotics in the first couple months of life can really diminish the risk of those children developing allergies and asthma and eczema later on. So that's one thing that I think about doing. And then in terms of other supplements, while nursing, babies get whatever we take, so we have to be careful. But if we take a multivitamin or we take vitamin D, they'll get some. I think the research is pretty strong on vitamin D. But again, what about being out in the sun, forest bathing for our babies, and spending time outdoors with them? Maybe they don't need to take it as a supplement. But for toddlers, I think what the recommendations about 1,000 IUs. And then, as kids start eating solid foods, there was another question about that, so we can talk about that. But, the concept of letting kids feed themselves, they know when they're hungry, they know when they're satisfied. They've been telling you that with a breast or a bottle, they know. And so giving them soft foods, my kids got really mushy broccoli stems that they could hold in their hands and gnaw to death. They got asparagus. I put lentils on their, tray, and start with giving them a variety of foods. And also, as they hit about a year, you can start just giving them what you eat. Start giving them the kind of food that you eat, and see how they like it. They're not going to like salad at a year old, but they might like a carrot if you cut it up in little enough pieces so they don't choke on it. And so just letting kids feed themselves, letting and don't treat them like kids. My kids were eating sushi. They were eating tamago, which is egg sushi, and they were eating salmon roe sushi because they liked how it popped in their mouths when they were like 1.5. They liked those foods. They liked pad thai. They liked whatever we had. And maybe I was just lucky I didn't have picky eaters, because my stepdaughter was one of the pickiest eaters in the world, but she's not anymore, thank goodness. So as far as supplements, the most important part of a good multivitamin for a child is that they like it and they'll eat it. I used to work in a health food store, and we always had several bottles under the counter, and parents would come in and we would just ask the kids to taste them, and then they could choose one. So if I was in practice and working with a lot of kids, I would have a couple different varieties in my office and see what they liked. I also like the little fishies, the fish oil gummies for kids. I think that can be really helpful for them. But generally not too many supplements. Although my kids used to ask for probiotics. They'd go, "More Daphilus, mommy, it's yummy." I just put a little pinch on their hand, they'd lick it off. It was really easy.
That's great. Yeah, I just yelled to my wife, Liz. We have 2 little ones. I was like, "Get the lentils out for Bennett. We got to make lentils." That was a great suggestion. That's awesome. Yeah, one of our cohort members asked, is it normal for an exclusively breastfed baby to suffer from constipation? What might be going on there?
It can happen. It doesn't happen that often, but it can. And so, first of all, is the baby seem uncomfortable? Because babies may not poop as often as you think they ought to. So I wouldn't worry about that. The other thing is the baby getting enough fluid? Do you have enough milk? Are you rested? Because the number one reason why moms don't have enough milk is that they're not resting. And again, a little pinch of probiotic might be helpful. And yeah, I think those are the places that I would just start looking at. And, just like with adults, you can do kind of a circular massage up the right side of the colon and across the transverse colon and down. And you can just kind of do a gentle with, 1 or 2 fingers, just kind of a gentle, clockwise circle. And see if that kind of helps. And sometimes you might even be able to feel if there's really constipation there. I know you can often feel gas pockets or constipation if you do it on yourself. Experiment with yourself and see if that makes sense to you.
Yeah, my son, everybody, he's now 11 months. Maybe a few months ago, he went about 4 days without having a bowel movement, and finally he had one. And he was, at that point he was eating a little bit of food, but still breastfeeding. Yeah, Liz, this is probably the $1 million question, right? This is such a hot topic, this one, whether it's for kids or adults. Now you hear it all over. Here's the question that someone sent in: knowing how inflammatory gluten and dairy can be, should all kids be free of those foods from the get-go?
So I looked at some of the research because I hadn't looked at it for a while, and the research is still pretty interesting. It's counterintuitive.
Mm-hmm.
I think for certain foods like wheat and dairy, I would wait until they're a year old. Honey, definitely, because it can have botulism. But it's interesting, the research on peanuts and eggs and some of the other real big foods indicates to start them somewhere between 3 and 6 months, little tiny tastes. And there seems to be, especially for eggs, not raw eggs, but really well-cooked eggs, it seems like there's fewer egg allergy reactions in children who've been introduced it early rather than waiting until they're a year old. And I know that my first son, somebody around 10 months old, when he was about 10 months, their baby was a little bit older and she had a mixed grain cereal. And he had a little bit of it and had some wheat in it. And he got a big red welt within about 10 minutes. So it's like, okay, well, we're not doing that again. We're not doing that again we're going to give this another 4 or 6 months before we try this again. But most kids are going to be pretty okay. Can I share my screen?
Yeah, Liz, we have it set so anyone can share the screen.
Okay, so let me just kind of show you this. So this is something that I pulled up. This is the EAACI guideline, a consensus statement position paper out of Europe from 2021. And I'm going to move all of us so that I can actually see this. So the recommendations, children relate to infants up to 1 year and young children up to 5. And what they said was, suggest against the following for prevention of food allergy. Here. Avoid cow's milk formula as supplementary feed for breastfed infants in the first week of life. I would just avoid cow's milk, period, for at least 8 or 10 months, probably a year. You might try a little bit of yogurt or kefir, but other than that, I wouldn't use cow's milk. It's hard to digest. And also, I'm not going to go too deeply into it, but if you get a half gallon of milk, you could have hundreds of different cows' milk in there, and who knows what they have. So, and then it's pasteurized and it's got broken proteins, and there's lots of issues that can happen with it. So I'm not a big fan. They introduced well-cooked but not raw egg, or uncooked pasteurized egg. They recommend that, again, from 3 to 6 months. And if there's a high prevalence of peanut allergy in the family, again, they want to do that between 4 and 6 months of life. They want to do a couple of introductory times. And it's so counterintuitive to what you would really think about in terms of what we would think about doing. But there's been a lot of research in Israel and other places about just giving little bits of some of these highly allergic foods early. We even have some research on giving a little bit of gluten early to help prevent celiac disease. So, you just have to use your best judgment on it, but, giving a little bit and seeing how the baby does, and just doing that a couple of times early. And it's this 3 to 6 month window, which is really early for a lot of this stuff, that they might be more tolerant, especially if they're still nursing, because the immunity that they get in the mom's breast milk and the prebiotics and all the other good factors might make them more tolerant than as they get more weaned.
Yeah, that's fantastic. I know Corinne deals with this a lot, and my son actually, guys, I might have mentioned it. When he was exclusively breastfed, whenever Carrie ate, dairy was the first food we noticed. He would get these red patches on his cheek, and so she had to cut out dairy, and it goes away. And it happened a little bit with gluten too. I don't think we've tried to reintroduce it all through solids, but yeah, great stuff there. Those are 2 foods that are always coming up, Liz, even in the DCN.
3 eggs too. Those are
Yeah.
the big 3. And they're, if you're sensitive to lentils or kidney beans or sesame seeds, those are more transmutable, but these are the big 3 that often don't move.
Mm.
And what I learned from Lyndon Smith, who was a pediatrician, he said, babies start out with dairy issues, and you might see it as little pimples, or you might see it as constipation or whatever. And then what starts to happen is that as they get older, they start getting ear infections.
Mm-hmm.
I've worked with lots of kids who get tubes in their ears, and then we take them off. I recommend that they go off dairy, and they improve so dramatically. And then as they get older than that, maybe they start getting lots of recurring strep throat. And then they get to be a little older, and their acne during puberty is really bad, or they get migraines. It's not necessarily that they outgrow that lactose intolerance, but it changes in nature as they grow.
You just spoke as if you were speaking to me, Liz. My mom and my dad had to, tubes in my ear, adenoids removed from chronic ear infections. I was, as I go through MUIH and whatnot, I'm curious if it was dairy. And now as an adult, I don't really consume dairy that much. I'm, 99% of the time I don't, but I get strep throat frequently. And that's really interesting. Yeah.
We are such funny creatures, all of us. The other thing I think is really important for infant and toddler health is avoid antibiotics if you possibly can.
Yeah.
Because we're developing the microbiome until the child's about 3. And if we can leave that undisrupted as much as possible, it's really best, because it allows the immune system to develop in a really congruent way.
Let's do this, guys. Let's end with a question on sweeteners, and then we'll let Liz talk about her digestive wellness course as I take a peek at the time here. So Renata, I think, sent in this question, and she might have put it in the chat too. What are your thoughts on sugar and sugar substitutes, artificial sugars on the gut microbiome? And what's best maybe for a client that's dealing with some GI issues?
When we look at the data, the average person's getting about 100 pounds of high fructose corn syrup and table sugar a year.
Mm.
So my big question is, I'm less concerned with what kind of sugar they're getting as to the amount of sugar that they're getting. So as always, like every question is, it depends, right? And somebody who's healthy, they can have a piece of cake or a slice of pie or a couple of cookies once in a while. So what, right? But then my favorite sweeteners, what I use in my house is I have some coconut sugar. I have some unrefined sugar like turbinado sugar for my husband because he likes it in his coffee. I have honey and maple syrup. And the idea is we just don't use a lot of any of it. And then for the artificial sweeteners, we used to think erythritol was okay. Now we're starting to see some negative press on it. A lot of the monk fruit that people are getting is not really monk fruit. It's 90% erythritol.
Mm-hmm.
And the sugar alcohols have their place, like xylitol. I think of all of the sugar alcohols, we have a lot of really good research on how it prevents cavities in kids. When my kids were little, I went through this little phase of buying them sugar-free xylitol gum because I thought it would be helpful for them. They never had any cavities, so I don't know why I was doing it, but just, I think xylitol can be okay. I think that monk fruit can be okay if it's real monk fruit. But the question for me is always, why do we need so much sugar? And back to kind of breast milk, if you ever tasted it, it's pretty sweet. We like sugar, we run on glucose, but the microbes also really love sugar. So if somebody's got small intestinal bacterial overgrowth, or they have fungal overgrowth, then or dysbiosis of any sort, then we really need to limit carbohydrates. And I think that was one of your other questions. So when I show you about the course, I'll show you one of the handouts I created about that.
Yeah, let's do it, Liz. I'm sure you can want to share your screen here. We've had several
Okay.
people reach out to me individually, and they're really interested in your digestive wellness course. So yeah, this would be fantastic.
So one of the questions that got asked, and I'm going to do this first, is, oh my gosh, what was the question? It's like, how do you decide which gut therapeutic diet to use?
Yeah.
Okay, so this is a handout that I made for the course to think about, kind of walk you through kind of how I think about it. And I do it based on the research. Now, that said, you know, my ideas shift over time. And what if for most people, because they're eating so terribly to begin with, what if we just tried a good whole foods diet for like IBS or GERD? A lot of people would feel a lot better just doing that. So that, you know, my ideas are starting to shift because we're starting to see that a Mediterranean diet, and I use that term really loosely, I think any traditional diet. So if you're from Indonesian culture, what's a traditional Indonesian diet? If you're Malaysian, what's a traditional Malaysian diet? Because those developed over millennium. And if they weren't balanced, then people would have gotten really sick. So, you know, any kind of really good traditional diet, I think can be a great place to start, but based on the research. So here's kind of my flow sheet. My health goals are to achieve general good health, then follow a whole foods Mediterranean diet. And that's not perfect. It's progress, okay, most of the time. Addresses specific issues and get rid of frustrating symptoms, okay? So then I go down here. I've been diagnosed with a specific health issue, yes or no? No, I don't know what it is. Then I would just start with a comprehensive elimination diet. But I have been diagnosed with something specific. So in that case, what I would do is I would look at what the research says. So the research says if you have irritable bowel syndrome, follow a low FODMAP diet. Now, I know we're using that also for small intestinal bacterial overgrowth, but we don't really have a lot of research. We've got one paper on it. For inflammatory bowel disease, the specific carbohydrate diet or comprehensive elimination diet, because both of them work really well. And right now, someone I teach with at IFM, oh gosh, I'm blanking out on her name. She's a gastroenterologist who specializes in inflammatory bowel disease at Vanderbilt Hospital and University. And yeah, I'm really blanking out on her name right now. But she's been putting everybody on, all of the IBD patients, on a 12-week elimination diet to see what that will do before they put them on medication, on heavy duty medications. And they're having great results. So those are the two diets I would look to. Yeast overgrowth, follow an antifungal diet. Everybody's antifungal diets are different. We have almost no research on antifungal diets, which is odd but true. But generally they're really low in carbohydrates. And that's what all of these gut diets are, is they're all very low in carbohydrates or certain kinds of carbohydrates. Like, for example, the low FODMAP diet is low in prebiotics. Well, prebiotics are so great for us, but sometimes we have to starve the microbiome, and the prebiotics are the food for the microbiome. So sometimes we temporarily starve the microbiome to let it regroup and reboot, while a doctor's giving them antibiotics or herbs or whatever, or maybe we're trying to reset the microbiome with herbs and things. So thinking about it that way. For autoimmune disease, there isn't a Renew food plan anymore, but a Paleolithic diet, an elimination diet, and I think even a ketogenic diet can be really great, but we don't have the research. We do have research on inflammatory bowel disease and a paleo diet. And then celiac disease, gluten-free, obviously, 100%, absolutely. But what if somebody's still not feeling amazingly better? Well, then I would add an elimination diet. I remember working with a dietitian who has celiac disease, and she specializes in celiac with her patients, and she was still not feeling well after 12 years of being gluten-free. And I said, well, let's try just a comprehensive elimination diet and let's just see what happens. With 2 weeks, she was starting to feel so much better, and she was maybe 50% better than she had been, which was really encouraging to continue. And then with eosinophilic esophagitis or eosinophilic gastritis, follow the 6 food elimination diet, or again, the comprehensive elimination diet, which eliminates more things than the 6 food elimination diet. And no surprise, what are the foods that are most likely to be causing and contributing to the eosinophilic esophagitis? Dairy, gluten, and eggs, with dairy being really prevalent in more than 60% of people who have eosinophilic esophagitis. So those are kind of those things. And then I've been diagnosed with a specific issue, choose a diet that, so anyway, and then if their symptoms improve, great. If somebody's on the right diet, within 2 or 3 weeks, they're going to feel a lot better. I think you've already noticed that in your own practices or with your practice clients, and you're going to really see that. And then what you're going to find also is that you can also choose other diets. Okay, so you can say, well, I suspect I have an enzyme deficiency. So then you could try a lactose-free diet, a sucrose-free diet, a fructose-free diet. We can only absorb about 50 grams of fructose, and we're just doing so much consumption of high fructose corn syrup and fruit year round that a lot of people are just overdoing. And while fructose intolerance that's hereditary is rare, we're starting to see a lot of people who have IBS who just are getting too much fructose. So kind of looking at that. If you suspect there's dysbiosis or SIBO or fungal overgrowth or parasites, then think about specific carbohydrate diet, antifungal diet, low FODMAP. I suspect I have autoimmune disease and or leaky gut. So here's the ones that I think about. Again, comprehensive elimination diet. Always with autoimmune disease, I think about gluten-free, dairy-free, casein-free. Rotation diets I would use if somebody's reacting to everything. So maybe again, like with that mast cell issue, maybe rotating foods would be a way to kind of move through and not have a food more often than every 4 or 5 days. Low histamine diets, again, for mast cell or somebody who's allergic, and 6 food elimination diet for immune issues. And then I just feel debilitated, malnourished, or maybe only able to eat a handful of foods. We think about elemental diets, and then I made up one that I just called the restoration diet, and it's basically like a baby food diet for adults. Think about how you would start a baby. Oh, purees and soups and stews, and maybe a little bit of kefir or cashew coconut kefir, or little bits of sauerkraut juice. Just kind of really easy to digest foods. So this is an example, and I can send this to David so that you can have this. This is an example of one of the handouts in my course. So let me just show you the course. I have 3 courses actually. So I'll show you the online course that's self-paced. And then in the fall, I'm definitely going to be offering an advanced nutrition forum that's for people who are already been in practice at least a year or two, and they want to brainstorm, bring in cases, participate in a peer group where everybody's sharing. And to be honest, like today, the group was, and I saw from the transcript that I had spoken 34% of the time. So I'm still teaching and I'm still like really involved. And there's group genius. There's just so many unexpected perspectives when we get together, and there's small groups. They're 10 to 15 people. So that's an ongoing group. And I have people in it who've been in it for more than a year. They just keep signing up over and over again. And then there's always some new people. In the fall, I may have a digestive health support group that works the same way. And we use the course, the digestive wellness course, as kind of the jumping off place for it. And then I have this online course that I'll just show you right now. So here's the course curriculum. And what I've done is like, here's handouts. So if we look at part 1, fundamentals, here's the course handouts, a whole list of all of them. The IFM timeline, preparing your own health timeline, digestive health appraisal questionnaire. And why do we have that there twice? I don't know why we have that there twice, but that's in part 1. And then if I go back and I go to, also in there are, and you can also get these on my ResearchGate site. While I was teaching DCN students, I put an idea in their brains. Like, I wonder which probiotics work best for which health conditions. And 7 of them took me up on it and handed me a 200-page paper. And I thought, if I'm the only one who ever sees this, what a shame, because it was brilliant. And so I reached out and we published them as 9 papers in Integrative Medicine at Clinicians Journal. And so they're here for download, as well as other papers I've published. So in part 2, you'll see here's the dig-in model and the 5 R's. And this is me right before the pandemic. And so there's videos of me sitting in my living room telling you things, and then there's audios of those. And then there's also a quiz at the end. So if you take the quizzes then, and you pass all the quizzes with 70%, then you get a certificate that's good for CEUs through ANA or NANP. I've let the dietitian ones expire for also some nutrition coaches can get that. So some in part 2, here's some of the lectures, a deeper dive into enzymes, how I think about them, how I use them, what your poo tells you, leaky gut and lipopolysaccharides, overview of the microbiome, systemic effects, circadian rhythm in the microbiome in the life cycle, probiotics, probiotics from food. I'm a big believer in cultured and fermented foods, if you can tolerate them. And then dysbiosis, SIBO testing and treatment, SIFO testing and treatment, stool testing, looking at all the different kinds of stool tests. They're going to give you very different information from company to company. So depending on what you're looking for, depends on what test you're going to want to order. Part 3 is returning to balance. And again, there's handouts. So in here, wellness wheel, self-assessment, food diaries, emotional eater's diary, some recipes, a guide to eating out, the Which Diet flow chart, which I just showed you comparing different therapeutic diets, what's similar and different about them. Because sometimes when somebody comes in, like I remember working with this woman, she had actually Lyme spirochetes in the synovial fluid in her knee. And she had discovered that if she ate a really low carbohydrate diet, that she not only lost weight, but that she felt better. And when I looked at what she was eating the specific carbohydrate diet, but she had narrowed it even more. So what I did was I expanded that, because based on what she was doing and already felt really great. So how do we choose the right diet? And so I have, and then there's videos on all of this. And then I also have cooking videos. I have me in my kitchen making stuff. You can see it's like 4 years ago, so my hair was way short and way darker. And so cooking demos, my daily smoothie, cashew coconut kefir, which I have on hand all the time. I think it just tastes so delicious. Bone stock, new dill pickles, ghee, granola, hummus, Patty McManny's MUIH graduates family recipe for kimchi, which I've modified, chia pudding, baba ganoush, almond cranberry muffins, which are specific carbohydrate compliant. And then there's all kinds of other things in here that I started doing a nutritionist collaborative cookbook with about 5 of my peers, including Eleonora Gafton from MUIH, Deanna Minnick's Nourish Your Whole Self workbook, Jill Carnahan's Toxic Mold Exposure, How Mold Plays a Role, and then the Kid Lunchbox Generator PDF from Emily Nielsen. And then a paper I wrote on understanding functional medicine, and then all the references for all the editions of Digestive Wellness. So it's a packed course. There's, I think, over 40 or 50 different handouts. There's so many videos, and everything's downloadable for you to keep except for the videos. And I'm planning at this point on closing this course next January, at the end of next January. So in a little less than a year. It takes about 20 hours to complete, and you get 20 CEU credits for NAMP or the ANA, and 24 credits for people who are from the NTA, Nutrition Therapy Association. So that's a little bit about the course. And if you have any questions, you can send me an email, or you can comment or ask me right now.
Yeah, this is great, Liz. I'll definitely post this, guys, in the announcement I always do after we have a live session. And so, Liz, did I get the link right? Is it just innovativehealingacademy.com for people to sign up for this?
It is. And then if people are interested in, I don't know where you all are in your practices, but if you're already in practice, you might be interested in one of the mentoring groups. And again, I may be doing one that goes with the course in September. I may not. And I'll definitely be doing an advanced forum. And you can read about that at innovativehealing.com.
Yeah, keep us updated, Liz. You can always email me, and I can get it to all of our members. I think we have several that would be very interested in learning from you a little bit, a little bit more. That would be great.
I'm in this conundrum. I'm in a conundrum phase in my life, because being in my early 70s, I'm ready to see what else is out there in the world. But I also have a pretty deep reservoir of experience and knowledge. And I think that's a shame to waste it as well. So I'm trying to, as E.E. Cummings said, I have this problem of going out to save the world or enjoying the world. Every day I wake up with this problem. So I think we can do both, because hopefully you'll love this field as much as I love it, and you'll find a way to find your own personal balance.
Yeah, I'm glad you're able to rest a little bit this summer, Liz, before getting at it again in the fall. Any questions for Liz tonight, guys, as we kind of start to wrap up here? Thank you so much for the time tonight, Liz, too. So generous.
You're most welcome.
I have one quick one. Did you say that course is going to close in January? So like if we want to do it, we have to do it this year. Is that what you mean?
Yeah, I'm toying with updating a few of some of the materials. Most of them are really up to date. Like maybe 6 or 8 months ago, I updated the GI testing lecture and totally revamped that. And there's another lecture on probiotic supplements that I want to revamp. Otherwise, it's really up to date. I just feel like it's 4 years old. It's going to be 4 years old soon.
Mhm.
And so I'm just not sure. We've been announcing that it's closing. And then I have to make a decision about that. I was just talking with my husband about it, and he's like, well, we've been announcing it, so you have to decide what you want to do.
Yeah, guys, definitely consider taking advantage of that. That seems like an incredible opportunity to dive deeper into digestive wellness. Got a lot of thank yous in the chat, Liz. I don't think any last questions. Let me take a look. Yeah, thank you so much for the time. Email me anything that you want me to get in front of our members, Liz, and I will absolutely do that. I will pass it along to them. And yeah, I think that's it. Thanks so much tonight.
Thank you all for being here.
Yeah.
Thank you so much.
All right, guys. Everybody have a great night. Get some rest.
Bye.
All right, guys.